A fundamental challenge in medicine is how to best answer patients' basic questions. Am I healthy? What diseases am I most likely to get? What is wrong with me? What caused my condition? What's the right treatment? How will I know that my treatment is working?
I'm just so grateful that, one, there was a diagnostic test that detected my cancer, and two, that I had a great doctor and a great team who could read that test and they knew immediately what to do to save my life.
Today, the medical diagnostics industry is developing innovative new tools to unlock these mysteries.
If we just had to rely on what we can see or maybe hear with a stethoscope, we really would only be able to see some of the surface phenomena with patients. With blood tests, you can actually look at what's going on in individual cells. It's extraordinarily powerful to have that cellular knowledge. And with a blood test or with a tissue test, we can often look at the entire body with a single specimen.
Medical diagnostic manufacturers make tests found everywhere from the high-speed machines in laboratories that process hundreds of tests per hour to the blood glucose and pregnancy tests available at the local drugstore.
The use of modern diagnostics is like taking a doctor out of the cockpit of a biplane and putting them in the cockpit of the space shuttle. Diagnostics give doctors a wealth of information that they need to know to understand what's going on with their patient, to determine what kind of treatments are appropriate, to determine whether the treatments are working down the road, and even to do follow-up monitoring to find out if the patient's staying healthy.
Vital insights that get patients back to health, back to work, back to life.
About 30 years ago, about 50 to 55% of all breast cancer cases, being male or female, stage 1 or 4, about 55 of these breast cancer that were diagnosed would die within 10 to 15 years. The number today is 18%, so it's roughly 1/3. So this is the best example how we made progress, which of course is also early diagnosis, which means screening, which means also our treatments that are called adjuvant treatments. But in order to tailor these treatments, we need the exact diagnostic testing.
Today I'm cancer-free, I'm healthy, and I'm happy, and I want to make sure that if I'm diagnosed with anything, it's in the early stages so we can treat it and knock it out.
But outdated government policies in the U.S. are slowing patient access to the latest advances. It's taking longer to get new tests approved. Our health system discourages innovation because new tests are paid based on 1980s technology. It's an increasing challenge for the U.S. diagnostics industry to stay competitive with other countries. In 2010, the leading manufacturers of medical diagnostics came together to form a new advocacy organization, AdvaMedDx.
AdvaMedDx advocates for the value of diagnostics because many stakeholders, even patients and doctors, don't fully recognize the value that diagnostics have in the whole healthcare system. Not only do they provide information that doctors need to make critical diagnostic and treatment decisions, but they actually help save the healthcare system significant money by catching disease early, identifying the right treatment for patients so that money and time are not wasted, and even helping patients follow up on their care and ensure that they're remaining healthy.
My doctor found my cancer through a Pap test. I think about years later how we have this amazing diagnostic test, but yet there's still so many people who either don't get it or don't have the resources to get it, or they just think that it's not important enough.
AdvaMedDx is working to usher in a brighter, healthier future, bringing people together, educating stakeholders on the value of modern diagnostics, and advocating for change. While AdvaMedDx member companies are transforming care by bringing advanced technologies to patients.
What will happen in the next 10 to 15 years in personalized medicine? I think that's the key message. Each patient will be taken as an individual. As opposed to what we did in the past, we told the patient, you have such and such disease and this is how we treat it.
Diagnostics not only are transforming the way we diagnose and treat disease, but are also reducing overall healthcare costs. AdvaMedDx and the medical diagnostics industry are committed to ensuring access to advanced diagnostics for all patients and transforming healthcare through diagnostic innovation.
Which will lower healthcare costs in the United States.
Which means better healthcare for my patients.
Which means tomorrow's medicine today.
which means better health care for me, my family, and my friends.